My name's Allyne Topaz, and I came to SIU for their Hand and Microsurgery Fellowship Program. Prior to this, I was a chief resident in general surgery at the Brooklyn Hospital Center in Brooklyn, New York. The reality of the global pandemic didn't really hit us until about March, when we realized that what was happening in Italy was going to completely happen to us. We felt falsely secure because we felt that we were in New York City, we have all the resources needed, there couldn't possibly be a situation where what was happening in other parts of the world could happen to us. That was very untrue. We ran out of supplies very quickly. What I saw was akin to what you might see in a third world country. You do not expect to see that those circumstances happening in the United States of America, where you are short on ventilators, converting cafeterias into ICUs, all hands on deck, no matter what your specialty training, and surrounded by people that are dying despite all the medicine we know and all the advances in critical care that we have. It really made no sense, and we were throwing everything we knew at them, and it was just not working. The reality was crushing. When it came full force, we didn't expect it to be of that magnitude. My fiance still lives in New York. He works at Stony Brook University, which is in Long Island. They were a much bigger hospital than us, so they had to establish a field tent outside. I believe it was a 400-person capacity field tent outside the hospital. The hospital is about a 1,000-bed facility. It was all hands on deck. He got recruited for 3 months to the ICU as a radiology resident. We had daily crash sessions where he would drive and I'd walk to work, and he'd drive out there, and we would review pressors. How do you manage a vent? How do you manage hemodynamic instability in general? Things that, critical care elements that he hadn't focused on in actually ever, but were now his responsibility. He was responsible for about 20 COVID ICU patients, intubated patients at a time, and it was devastating. It was actually incredibly emotional, and he watched a lot of people like myself that were our age die or our parents' age dying, and we had no explanation for why things were not working. We worried about resources such as vents. Who would we have to give it to next? You worry about ethical dilemmas that you don't ever want to consider in this country, in a first world country. So I think that impacted both of us greatly.
You bring those burdens home?
I don't think it's possible not to. Yeah. I think if you're human, you have to bring those home. And there were such touching and beautiful stories that happened in the community that you can't help but bring that home. Yeah, I need a minute.